There is a rise in the abuse of prescription drugs in Nigeria, and this is leading to more antimicrobial resistance. The Nigeria Center for Disease Control is now embarking on a sensitization campaign on the issue, which is considered as one of the top 10 global public health threats. Amaka Ode here has that report.
Like many countries, Nigeria is not exempted from antimicrobial challenges, as self-medication is a common practice in the country. Experts say it will continue to pose a threat until there is an attitudinal change to the abuse of drugs.
Before antibiotics or antimicrobials were discovered, normal scratches, people that had cancer, people that are immunosuppressed, children and adults, they fall ill from infections and die. But these antibiotics have now come up and people are now getting better. Once they take the drugs, they become better. But if resistance occurs, then we are exposing ourselves. We are going to what we call the pre-antibiotic era, where some normal scratches can kill people. It may include antibiotics, it includes antifungals, it also includes antivirals. So as many drugs that we use for treatment of infections that are no longer working.
The abuse and overexposure to antibiotics is a key driver to resistance, which also extends to animals and can be detrimental to health.
We are advising animal owners to consult veterinarians whenever their animals are sick, so they use these antimicrobials prudently and only when it is needed. Because sometimes, when they are treating these animals, there could be residues in food of animal origin, such as eggs, meat, milk, and so on. So we advise them to seek professional advice before using these products.
Despite existing laws in the country prohibiting access to drugs without prescription, lack of awareness is still a major challenge.
They buy drugs, but not be anyhow drugs what they use.
Yes, at times.
You do that sometimes,
Yes,
but do you know that is detrimental to your health?
I don't know.
You don't know.
Healthcare should be given free most of the time so that people won't be discouraged. Maybe during this coronavirus era, people will think if we go to the hospital, they might say it's corona. So a lot of people nowadays are afraid of going to the hospital so that they won't be quarantined. So that's why nowadays people are usually going to all these drug sellers and hawkers to buy drugs.
Antibiotics are precious goods. If you are ill, go to the hospital. A test will be done and you'll be treated. It also reduces cost. When you do not treat what you are having, you use so many drugs, that means you are spending more money.
Research has shown that 80% of Nigerians don't even know that they're actually abusing drugs, especially antimicrobial drugs like antibiotics, because in the country, antibiotics is supposed to be prescription only. But as it stands, anyone who has any symptoms, go to the hospital, get these drugs and abuse them. And eventually when they fall ill, these drugs that are supposed to help are no longer effective. And that's why this awareness campaign is ongoing here in the nation's capital, Abuja. For Arise News, I'm Maka Ude. And to discuss this further, we're now being joined by Dr. Yahaya Disu. He is the National Incident Manager at the Nigerian Center for Disease Control. Thank you, Dr. Disu, for coming out tonight. I know it's been a long day. We're all out very early this morning, so we appreciate you being here. Well, this is a conversation we need to have. The fact that we're seeing a rise in the abuse of antimicrobial, or just drugs in general, in the country. Are we doing enough, really, to enlighten the people, the dangers of abusing drugs?
Yes, I want to quickly clarify something. I'm the head of communications for NCDC.
Oh, okay. Sincere apologies for
yes,
that.
we actually were planning for somebody who is the head of the National Incident Manager to come before, but I think that's where the mix-up came in. So I don't think we're doing enough because it requires all of society approach, in the sense that you need the local government, you need private sector, you need state government, everyone to be on board. Like it was said earlier that it's one of the top 10 threats to global health, as stated by WHO. So it requires urgent multi-sectoral action at all levels, even the community. Farmers abuse antibiotics. They use it to promote growth in animals, and then you know what this means. The residue eventually will get into man. So the problem of resistance is both for man and animals, and including plants. So that's why we need intensive and massive campaign awareness creation for people to actually know the dangers that this portend to us. And like my colleague was saying earlier, before 1940s, before the Second World War, we had no antibiotics. So any little infection, people just survive by mercy of God, and then maybe at the mercy of nature, let me put it that way. Those who cannot survive will not survive, and so they will just die. But with antibiotics, now people survive many things. And more importantly, there are surgeries like cesarean section that we do, and then also there's some very intensive surgery like hip replacements, and as well as people who have cancers. And it's because there are antibiotics that are effective to prevent against infection that can consume those people. So with resistance now, that means we will go back to the days of pre-antibiotics, whereby the practice of bloodletting for curing diseases, curing ailments, use of maggots and all those things, and it won't help anybody. So we all need to be involved in this.
So, I mean, from the WHO submission too, that it's part of the top 10 public health threats in the world. Would you say that we're in dire straits here in Nigeria, particularly when you find that some health regulators are not really helping matters? You still find people hawking drugs on the streets.
In fact, it's a bigger problem than you even think, because we don't even understand the magnitude of this problem. First and foremost, we need surveillance to understand the magnitude of the resistance and even the antimicrobial use in the country, the pattern. And then, so when you don't even know those basics, now it's even become difficult for the health authorities to even enforce any legislation that are in place. We have NAFDAC, even there are other health agencies who are empowered by the legislation to be able to ensure that people don't abuse antibiotics. So we have a problem, serious one, when it comes to surveillance, and we need capacity for that at all levels. And one of the things the NCDC and the Federal Ministry of Agri and Ministry of Environment are trying to do is to make sure that there are laboratories across the states whereby we can actually take samples to know the pattern of the resistance that we are having, as well as how people are misusing this. So that will help us to know what problem we are facing and how we are making progress towards this. Then the issue of legislation is another thing. We need a town hall meeting to bring all stakeholders on board.
And how is NCDC driving it first from its own perspective? And are you enlisting agencies like the National Orientation Agency, the Federal Ministry of Information, and their state's components?
Yes, there is a multi-pronged approach to this. First and foremost, we have a coordinating committee, even though the headquarters, so to speak, is in NCDC, but we have Ministry of Agri, Ministry of Environment as the major drivers of this. And then in each of those pillars, like for instance in awareness creation, we have National Risk Communication Technical Working Group, where you have the National Orientation Agency, Ministry of Information, and other relevant stakeholders who drive awareness about this. But we need this to get down to the state and the local government level.
Well, while you're talking about committees, let's also look at the fact that we live in the same society here. We know what happens here. Even looking at that little girl, she was talking about the fact that some people just for headache, they go get some sort of drugs. They don't like to go to the hospital. Health insurance, a lot of people don't have it. So going to the hospital is not a culture that is big here in the country, unfortunately so. So malaria drugs, antibiotics, the law has already said you have to take prescriptions to get these drugs, especially antibiotics, but everyone can have access to these drugs despite what the law says. So beyond all of these meetings and this, awareness campaign, what more are you doing at the NCDC to ensure that antimicrobial resistance does not consume us all?
Okay, awareness campaign is just one of the pillars for fighting this battle. One of them first is coordination and then governance, and I think I've talked about that. Sure. The second one is surveillance, and then we are having surveillance and system in place. Right now, some laboratories will be handed over this week to some hospitals across the state, and for them to enhance their capacity to do this surveillance. Then in addition to that, we also promote rational use of antibiotics among healthcare workers, and not just healthcare workers, even among farmers. So we're working in collaboration with the relevant ministries, especially Ministry of Agri, to ensure that this is done. So I think those are the major efforts that NCDC is making with the relevant ministries.
And has the development partners reacted to this new impetus that you're bringing, you understand, to drive the awareness, to curtail microbial threats in the health care system?
The development partners, starting from World Health Organization, FAO, that is Food
and Agricultural Organization.
So they are well involved in this. So we plan together. And in fact, we key into the global action plan for this. So it's not just that Nigeria is developing the plan in isolation.
What you want to quickly outline some of the key points in the global action plan? Some I know you've talked about, the sensitization, the work, to create awareness and the rest.
So one is, for instance, GLASS, establishment of GLASS. That is a global antimicrobial surveillance system.
Good.
So based on that, Nigeria is also able to develop its own surveillance system.
Yeah.
So we have planned that we have developed since 2016, and we are implementing that. Then exchange of sharing of data. For instance, this week, Nigeria and Germany, they share information about developments with regards to antimicrobial resistance, what they are doing and what we are doing. So we're learning from each other. Then there is going to be policy dialogues, and then for financing AMR, because AMR, because funding is a major issue. Once you have funding, you'll be able to drive research, and you'll be able to provide all the facilities that you require. Even awareness creation will require funding, jingles, hearing of jingles, and all those things.
Okay. Data is important, really, to drive home the message. Sometimes you need to scare people to make them understand how serious things are.
Well,
Dr.
thanks.
Yahaya Disu, Head of Communications, Nigerian Center for Disease Control. Thank you for coming.
Thank you for having me.